Devices are omnipresent in our lives. We have them, our parents have them, our children have them, they're in the classroom. We can't get away from them. But do we really know the impact that these devices are having on our children and the way that they live our lives? Children are now using devices from a much younger age. But what is the impact that this is having on their ability to interact with the world around them? Are they sleeping enough? Are they exercising enough? Are they seeing others around them, integrating with other people enough? Are they developing those key interpersonal skills? Are they emotionally regulated? We're seeing rising rates of neurodiversity, increasing rates of myopia, short-sightedness, increasing rates of obesity, increasing rates of mental health problems. I could go on. And we have to question, does the integration of these devices into the lives of our children have an impact on the development of all of these issues that we're seeing in society? My name is Dr. Charlotte Armitage. I'm a psychologist and psychotherapist, and this is Generation Zombie, how devices are harming us and what you can do about it. A recent article in The Guardian has found that the majority of the UK now self-identify as being neurodivergent. Research from 2021 found that there was a 787% jump in the number of diagnoses between 1998 and 2018 in the UK, and the number of children who have ASD, autism spectrum disorder, have now risen from 1 in 2,580 years ago to 1 in 36. So we have to have a look at what's going on here. What has contributed to the increase in this diagnosis, to this self-diagnosis? I want to welcome my guest today, Dr. Grace Hancock. Dr. Grace is a clinical psychologist and she works predominantly with neurodivergent teens. Welcome, Grace. Thank you for joining me today.
Thank you very much for having me.
So, Dr. Grace, what are your thoughts on this? What's your perspective of how the rates of ADHD and ASD are now rising?
Look, I think it's different, for the two different conditions. I think with autism, it's largely due to changes over the past kind of 20 years in how we're conceptualizing autism. There was the introduction of Asperger's syndrome, that led to, the diagnostic label capturing so many more autistic individuals, those that don't have an intellectual disability or a language delay or disorder, and those with less overtly impairing autistic traits. So it really saw a shift beyond those individuals that were previously captured in that disability, classic kind of disability group. And then research over time showed that there really wasn't that much difference between Asperger's, autism, and some of the other diagnostic labels being used then. And so it was all rolled into one and classed as what we now know as autism spectrum disorder. It got us to the point where now we're capturing a much wider range along the continuum of impairment. So we're also playing catch up, identifying individuals that were previously missed. And for example, adults that grew up in the years of much narrower conceptualization of autism, as well as females, whose autistic profiles were not well understood until years later, and some various minority groups also. I think, quite possibly what's also contributing to what we're seeing in this picture is children experiencing bigger emotions, more intense emotions, delays in their speech development, differences in their peer play, leisure, peer connections. These are all common to autism, but they're also common to and can be explained by overuse of screens and devices. And there's really clear evidence that links those two together. So I think that's where it really clouds the picture for what's going on with these rates.
I think it's really interesting that you mentioned that, actually, because screens and devices have been commonplace or are now commonplace in the hands of children. And it's getting younger and younger. And, a lot of my work really, I look at what is the impact of that? What's the impact of the young children using these devices and the impact that it on their interaction with the world, and how does that affect their development? And I think you're alluding to that there, that actually, is what we're seeing autism, or is it related to the screens?
Absolutely. And I think, when you mentioned about ADHD as well, and that's probably where I think, even more focus needs to be. ADHD obviously has a much narrower scope. It's that significant inattention, hyperactivity, both for a lot of individuals. With those huge increases in diagnosis of ADHD, I think, similar to autism, there were adults that were previously missed and now are finally being diagnosed after years of misdiagnosis, with psychiatric disorders commonly Also understanding better the internalized experiences of ADHD, teenagers telling me that I've got 15 thoughts going through my head at once. I can't action any of them. Those types of experiences that are hard for others to see. The other one being, though, modern lifestyle. Lifestyle for the most part, it's fast paced, it's multitasking, it's time poor, it's technology reliant, and it's across the lifespan, in all ages. And it's just our brains aren't evolved for that. And I think that's where we're seeing a lot of that difficulty, and it presents in a much similar way to ADHD.
Interesting. I did wonder this. Do we think that it's potentially, do we think that the increase in diagnoses or self-reports of ADHD, is it potentially the brain trying to adapt to the world? Is it almost an illusion? I can't get my words. Is it almost an evolutionary adaptation of the brain to cope with the multiple inputs that we're having on a daily basis now?
Yeah, and look, I think it could be. My hesitation is that if it were, it would be the human experience of that would be that life is easier, life is better because I'm adapting to it. I'm coping with it better, things are getting better. But it's not. People, children, teens, adults describe the overwhelm, the overstimulation, the brains are, overflowing, full. I can't manage all of this. So I don't know. It just like they're still struggling with it, I guess, is where I get stuck with.
Yeah, so actually we haven't adjusted, we haven't adapted. We're living in a world that we haven't yet evolved to inhabit with the amount of tech that we're using, and it's causing us problems.
Absolutely.
What do you think? I mean, my perspective is that I feel that the role of dopamine and the short form content that we are exposing children to, especially, but even adults, we are wiring our brain for inattentiveness, which is contributing to these, I expect, symptoms of ADHD. What are your thoughts on the role of dopamine in this?
Yeah, absolutely. I think, I often explain to parents that there's kind of a short term and a long term. So, in the moment, day to day, kids that are getting these frequent boosts of dopamine, they continue to look for that. And so lots of things in everyday life just aren't as interesting and aren't going to give them that same dopamine boost that they're getting from the screens. So schoolwork's boring, going out and just wandering around the park is boring, and their brain is looking for that distraction and looking for that upregulation through other things. But then I think, like what you were getting at, in the longer term, there's that process, that brain habituation, the neural adaptation that happens. The brain gets used to that higher level of dopamine that it's getting, and that becomes the new baseline. So then it's always looking for more, naturally, than that new baseline. And so it's almost like a tolerance that builds, really. And so that's when we see, kids constantly seeking more and more dopamine. The reward pathway in their brain has become desensitized. They're no longer finding motivation to do everyday tasks. Not much will hold their attention. And yeah, they are presenting with very similar picture to the inattention that we see in ADHD.
What would you say to someone whose child was presenting with these symptoms that look like ADHD? What would you say in the first instance?
Definitely that we need to work out what's underlying this. It, could be ADHD, definitely. There's, absolutely ADHD is a clinical condition that we don't fully understand, why it develops. There's a few genetic traits that we've linked it to. But, I definitely see it in kids that have had very minimal screen use. There might be 3 or 4 siblings in the family, all raised similar experiences and exposure to life. And one of them has very clearly, clinical levels of inattention and hyperactivity. So it's definitely, a real thing. But so are we looking at that, or are we looking at another reason for it? So we need to make sure that it's not screens that's causing it. So first of all, I always ask parents, what does screen use look like in the family? How often, how much, what activities, at home, at school, for example? Because I, as a clinician, would want to be really confident that I'm not, overdiagnosing or misdiagnosing a neurodevelopmental condition when in fact it's being caused by a lifestyle and a behaviour, being the use of screens. So working with the family really to tease that out, just so we can have that confidence around what's underlying it, I think is really important first step.
I think that's really sensible, and I hope that in the UK we start to bring that in as a first step when we're looking at diagnosis of ADHD especially. There is research out there, isn't there? There's quite a lot of research that evidences how the overuse of screens and devices contributes to the development of ADHD type behaviours, isn't there?
Yeah, absolutely. And, we've been looking at it recently, and it actually surprised even myself in terms of there has been this research coming out for 10 plus up to 20 years now. It's not just a new thing that we've kind of just cottoned onto. It's been there along the way. But as research is building and we're now able to do like meta-analysis studies where we're pulling together multiple studies, really large sample sizes, tens of thousands of individuals, and that is proving these connections between device use, the activation of the brain, and these ADHD-like traits, definitely.
I agree with you. This research has been around for quite a long time. And I think it's only now that we're really looking into that research more, because the amount that we use devices has increased, especially since COVID. I think children are on devices a lot more than they ever were. There are a lot more apps, there are more social media platforms. So they're more ingrained in our lives than they ever were before, which is why we're probably now seeing more of an impact of this on children, on society. And, it's going to take time for us to be able to conclusively say anything. And as with anything psychological, it's always multifactorial, but it does seem that they are a contributing factor towards the development of these types of behaviours. Now, what are you noticing in your clinical practice? You're a practicing clinical psychologist. You work with neurodivergent teens. What are you noticing in your work on a daily basis?
Yeah, look, a number of different ways, I guess, that I'm seeing this in the clinic. One of them in my kind of the education space is students using ChatGPT, for example, in their learning, in their study, for example, asking ChatGPT to pull up a summary of material that they were meant to read and digest and, summarize for themselves as a process for preparing for an assessment. And instead, they'll ask ChatGPT to do that for them. And, I work really hard to help them to see and understand that they've actually skipped that whole learning process then. That process of reading the information, thinking about it, thinking what's salient here, what do I really need to know, putting that into a summary. So the task of, writing it out helps encode it into memory as well. That's where the learning is, and they're skipping it. So that is one big area that I see being really concerning. The other one then, I guess, is technology use more generally, and in particular in the home, and parents feeling really powerless with this. And I find that really hard to see, and I definitely empathise with it and try to support them through that. They hold concerns about how much time their children are spending on, devices, technology, whether it's gaming, watching YouTube, social media as well. But they feel like they don't know how to manage it. Or most parents have tried. Then they'll list, off all the different strategies, rules, boundaries, things that they've put in place that haven't worked. And they're struggling then. They've got kids and teens that can't tolerate being bored, will get quite distressed being in the car unoccupied for a 20-minute drive or having to wait in a queue because they've been used to that constant entertainment, that constant, occupying their mind with something. So we're working with families around doing, taking a quite collaborative approach and, family device plans and things like that is a big part of the work that we're doing as well.
And is that working? Do you find that that's working to put the device management plan in place?
Yes, it definitely can. I think it often takes a few tweaks along the way. Not often the first, thing that we put in place works perfectly and, problem solved. It requires, parents to be collaborative in the development phase and working particularly with teenagers. Younger kids, you can have rules and things in place, but teenagers that going through that process of individualization, they want, their freedom, understandably. So if you can make it a bit more collaborative, that helps. And then also parents making sure that they are sticking to these particular plans. And I think that's where that powerlessness still comes through sometimes.
Empowering parents is one of the key things that we need to do here, isn't it? I've noticed this as well, that parents do feel powerless. Children have become very addicted to these devices, and they, in some cases, very late at night will have very big outbursts of anger if they have to put the device down. So empowering parents with those tools to help their child put that device down. Is there anything that you found that works particularly with this?
I think, particularly with younger children, we're always helping parents to look for the signs in their individual child that they've had enough time on the screens or that it's having an impact on them. All the published guidelines that come out around, how many hours a day to what age groups, definitely a great starting point to be looking at. But there's so much variation for each individual child as well. And so when you're talking about empowering parents, I'm wanting parents to feel comfortable and confident in knowing how much screen time my child can handle, and what impact and where is that impact that I'm seeing. And so we talk about what to look out for in young kids. It'll be, efforts to re-regulate, like bouncing on the couch, chewing something while they're watching. And with teens, it's more about spending more time on their own and dropping out of activities and less socialization. So really helping parents to feel confident, because then that confidence they can bring to how they're managing it in the family, whether it's through family plans or, rules and boundaries that they're putting in place. But if they've got that confidence behind them, I think that's what really helps it to be more effective as they're working through it.
Actually, as you're talking now, you can see how some of those traits might look like ADHD, can't you? If that's what it might look like to someone who isn't a clinician, you might be thinking, why is my child behaving like this? Not understanding what it is. You go on to Dr. Google and up comes some sort of diagnosis. So you could see how that could happen. Now, in terms of over in the UK, clinicians have different approaches to how devices are used with children who have autism and ADHD. Some clinicians say absolutely not, no devices, they're really unhelpful. Some say, and I think this is perhaps whilst we're waiting on research and for it to filter through our guidelines about how screens should be used, some say screens can soothe. What is your perspective on that? Do you think screens can soothe, or do you think they can actually exacerbate the problem in the long term?
Yeah, so look, in the moment, they can definitely appear to calm the situation. A neurodivergent child who comes home from school all razzed up because they've had to sit still all day and have been working hard to keep it together all day, they will sit quietly in front of the TV and watch TV. And parents, I completely get it, will think, great, that they're settling down. I can see my child literally, settling and sitting. Or an autistic child who might be experiencing really big disappointment in the shopping centre after they've been told no, they can't have a particular toy. And allowing them to watch an episode on your phone will likely distract them, and the distress will reduce that they're experiencing. What's also happening here is that children aren't getting the opportunity to find and learn ways to regulate their emotions. They become dependent on those devices to help them manage the emotion, and it's in less helpful ways like distraction. So on the outside, it looks like they're calm, but their mind is working in overdrive to process that input, the sounds, colours, movements, dialogue, storylines all at once. And you'll see that cognitive tiredness come out later, unfortunately, often at bedtime as well.
If a parent is trying to use the device, the child looks like they're calm, you think, great, fantastic, but what it seems is that actually we are potentially dysregulating that child even more, perhaps, and then, like you say, we have to catch up with it later on. Is there any advice that you'd give to parents who do have children who have ASD or ADHD? Is there anything that they can do to help their child regulate and calm down other than the screens or the devices?
There's not, kind of a one strategy that will suit all children. So really going to your child's therapists, whoever they're seeing, speech therapist, OT, psychologist, and raising this with them. And they will best understand your individual child, their emotional regulation needs, what has worked and not worked in therapy as well. And they'll be able to guide you with finding alternative strategies to trial. It is often a little bit of trial and error with kids. As I said all along, not one thing suits all kids. So it might be about, let's try this strategy. So when you are seeing those big emotions, rather than using the device as a distraction, let's use this strategy instead. We'll give it a few goes because, sometimes it takes a little while to see the benefit. And then either good, we've got it as a new strategy to use instead, or that one's not right fit for my child, let's try a different one instead. So really turning to that allied health team, I think, is really going to be the best option, and working on consistency. So the child will benefit the most and, I guess, adopt these new strategies best if all parents or caregivers are using them as well.
Yeah, so a consistent approach to that. And I think that can be quite a challenge, can't it? Especially if you've got families who maybe parents aren't together, or maybe grandparents are quite involved in the childcare, or aunts and uncles. It can be very difficult to have a consistent approach across childcare, especially with how screens are used, because there are some people that understand the risks of screens and some people who don't. Speaking generically, what would your advice be to any parent regarding integrating devices into the life of their child?
Basically, the younger they are, the less they should be using it as a general rule. When you are looking to allow some use for your child, things like ensuring they're having regular breaks when they're using it as well. So there is research that shows the longer a child's using a screen in one instance, the greater impact it's having on all those brain processes processors that we've been discussing. So ensuring regular breaks, opt for big screens like TV over smaller screens like iPads and mobile phones. And even in terms of what they're watching, if you're thinking about how much they're processing, opting for longer TV episodes or ideally movies, because that's got the one storyline. It's a lot less overwhelming, I guess, in terms of what they're processing. So those types of things can allow, still some appropriate technology and device use at home, but in a way that's going to have less impact on your child.
I think that the longer form content is far preferable over the short form content, isn't it? And we are now see, as far as we've had some research over here, Ofcom's Children's Media Lives reports found that children can now not focus for a full 24-minute episode, which is evidence of how the attention span is shrinking. I've spoken to schools who've said that their year sixes cannot focus for long enough to do their year six SATs exams.
Yeah.
So attention and attentiveness is declining in the classroom, which is compromising their ability to absorb the education system in the current format that it's in.
Absolutely. Yeah. And I think, with that, the shorter content, I know YouTube often gets seen in a, less dangerous kind of light, but some of them, the YouTube shorts, it's similar to TikTok. It's that really rapid, the videos just keep coming and they're short and it's new stuff constantly. It's, still quite dangerous, I think.
I agree with you. I think anything that has that sort of interactive element almost, isn't it? Anything that a child can easily swipe or move, which YouTube, TikTok, Instagram, all of those platforms, even the speech and language apps aren't necessarily that good for younger children as far as certainly what the evidence shows. So research conducted by Sapien Labs found that the younger a child gets a device, the poorer the mental health outcomes in adolescence and adulthood. And I think that really sort of tracks with what we're saying here today. Grace, thank you for coming on to this podcast today and for talking to us about this. I think it's such a big subject area at the moment and it needs more people to talk about it so that we can understand better how these devices are impacting us and how they're impacting our children so that we can make some changes. These diagnostic labels are very serious and they do stay with the child throughout their lives. Diagnostic labels are obviously useful when a child needs that diagnostic label, such as for accessing educational support, social support, therapeutic support, medicinal support. But we are seeing that people are potentially being labelled with these diagnoses that it may not be so helpful for that child. Having a diagnosis when you don't necessarily have that fundamental problem can impact how you see yourself, and it can impact that child later in the future as they mature into adulthood and they want to go on and do different careers. So it's something that we really need to think about, whether the label is needed, and addressing our screen time perhaps before going along that diagnostic route could be a first port of call before going into services. We need to look at what we can do at home first. And I hope that this has been really useful for all of our listeners out there. Thank you.
Thank you very much.
Thank you, Grace.
Thank you for listening to episode 1 of Generation Zombie, How Devices Are Harming Us and What We Can Do About It. If you'd like to learn more about Dr. Grace Hancock, you can visit ghpsychology.com. If you'd like to know more about myself, you can visit charlottearmitage.co.uk. If you want to see more of the research about devices and child mental health, you can go to bedevicewise.com/science. The book Generation Zombie also has a lot of information in there. We hope you've enjoyed this episode, and I hope you'll be joining me next week for the next one.